Today we're meeting on the land of the Kaurna people. We pay our respects to the Kaurna people and their connection to country. I also would like to pay my respects to our elders past, present and emerging. Hello everyone, my name is Irma Ranieri, Commissioner for Public Sector Employment, and I'm the South Australian President for the Institute of Public Administration South Australia. I'd like to welcome the public sector, IPA SA partners and supporters to a conversation with Professor Nicola Spurrier. Welcome also to Professor Nicola Spurrier, who has given us some of her valuable time today to speak with us. We also want to acknowledge IPA's major partners, the State Government of South Australia Chief Executive Council and IPA sponsors. We also acknowledge IPA's members and my fellow Divisional Council members. Now, for an introduction to Professor Nicola Spurrier, and I've had the great pleasure of getting to know Nicola over the last 2 years. Nicola was appointed the Chief Public Health Officer with the Department for Health and Wellbeing in 2019, shortly before the COVID-19 pandemic swept across the globe. So, much of her appointment, Nicola has been the face of the state's health response and our reassuring guide throughout the once-in-a-generation emergency. What a time to be appointed, Nicola. As well as navigating those regular press conferences, which you do so well, and that we've all become very familiar with, Nicola's role is to advise the Health Minister and the Chief Executive of SA Health about proposed legislative or administrative changes in relation to public health and communicable diseases. She brings more than 30 years' experience to this role. Not only is Nicola a qualified public health physician, she's also a paediatrician and has specialised in developing initiatives that address child health, obesity prevention and Aboriginal health. Nicola also has extensive experience in protection and promotion of public health issues, which requires expertise in forming partnerships and diplomacy, which you have tons of. Thank you, Nicola. Welcome today, Nicola. And I just want to get started with focusing a bit on your experience in leading this pandemic and just leadership in general. So how are we going as a state, Nicola? Let's just start with that.
Well, just first up, I am going to take off my mask, you'll be pleased to know, but I did want to make a point of keeping it on because even if we change rules about mask mandates, and there's no rule about me having a mask in here today, as you know, Irma, I think it's very good if we all use our own personal responsibility. I actually have a holiday planned in a couple of weeks. I don't want to be sick, so I'm making sure I'm wearing my mask when I'm around other people, particularly in indoor spaces. So that's
Thank you, Nicola. Great tip.
Yeah.
Excellent. Yeah.
So, let's have a think about this first question. So I was actually reflecting coming into this room or this building a couple of years ago when I was on the couch and having another interview for IPA, and I was thinking it'd be very interesting to have another look and reflect on what's been happening in the last 18 months to 2 years. But certainly it has been both a challenging time but also a very exciting time because you know that you've trained to do all of these sorts of things and make these sorts of decisions, and you've been given an opportunity to put all of that into practice. And it's also very humbling because of the responsibility that I hold in this position, and I think about the South Australian public every day when I'm thinking about the decisions, because that is what I would call my patient as a public health physician, looking at things through that population lens. So whilst there have been challenges, generally it has been exciting to really be part of leading a large team. I've had fantastic other people working with me in that leadership team, and we've had to build things up from the ground up. As many of my staff are saying, we're flying, we're building the aeroplane as we're flying it, because even though we had a strong public health system in South Australia, and we had planned for a pandemic, we couldn't have thought about it to the extent we've really had to respond.
Yes, that's true, and it's gone for so long.
Oh, absolutely.
Yeah.
It's the length of time, and at the beginning I remember sitting in a small room with the emergency or the disaster preparedness and resilience branch, about 4 people, and a few other people we pulled in, the chief nurse and people from mental health and whatnot, thinking about this pandemic, but it just accelerated and evolved so quickly that we really needed to expand up this very large team to carry out that response.
Very proudly. I mean, the public service has responded well, so thank you for leading that. So you mentioned your holiday. We're all actually mindful. I'm taking a tiny break over Easter. So given that, and you've mentioned the mask wearing to keep ourselves safe and not get COVID, anything else that you think we should be mindful of as we head into that little break at Easter time? Any tips before we kind of head off into maybe taking a bit of a holiday and school holidays?
So interestingly enough, when we have public holidays, and we've got ways now of monitoring people's mobility, we actually see a drop in people's mobility over that holiday period. So I'm actually looking forward to the fact that there'll be perhaps fewer people, there will be nobody going into work or fewer people going into work and having those contacts. And generally, it's the same as the Christmas period. People generally are catching up in their own small social circles with their family rather than getting out and about in the broader community. So actually, it will be good. And of course, we have children are getting a break. It's been really difficult in schools, it's not unexpected because we don't have the quarantine requirements for children and teachers. So actually shows you what quarantine does, how effective it is, because of course we're not having that. We try a lot of other things. The education department's been fantastic, trying to make it as safe as possible for kids and staff. But having the 2 weeks school holidays, I think will reduce that general mobility and contact between parents, between people in our state.
Fantastic. Well, good. Yeah. We look forward to a bit of that.
Yes.
Let's just sort of wind back the clock a bit and talk a bit about you, because a lot of people actually are looking forward to hearing about you in particular. So I want you to talk a bit about your career. And as a strong woman who's been leading the state, tell me about how your career has progressed. Were you always clear about this path? Certainly, I bet you didn't sit down and go, I think I'm going to lead a pandemic.
No, not exactly. Certainly not. Well, I was very clear I was going to have a medical career. And I think one of the reasons being I come from a line of doctors, but probably most importantly, my mother's a doctor and she was a pathologist. She's retired now. And it was just an expectation that I would study and I really knew what it was like to be medical, so that was the first thing that I had down on my list of things to do. And my sister's also a doctor; she's an ophthalmologist, so she was a year ahead of me at medical school. So it was sort of a natural way of going. But I remember thinking early on about the inequalities in people's lives in Australia, and I come from New Zealand, so coming over to Australia, I was quite struck by the inequalities, particularly for our Indigenous people in Australia. And I wanted early on to have a focus on that. And I remember thinking about a career in paediatrics, and I actually was toying up with the idea of going and perhaps working in Central Australia or something like that. And somebody said to me, you're better to get your qualification as a paediatrician, you'll be better off, you'd help more if you were a paediatrician. So I started off with my training in paediatrics, and about 3 or 4 years into that, the most wonderful person, Professor Fiona Stanley, came to Adelaide, and she came and gave the registrar group a talk about evidence-based medicine, and I was really fascinated, and she was talking about prevention, and I thought, gosh, it makes so much more sense. Instead of treating people and children when they're sick in hospital, you could actually prevent them getting sick. And I got so passionate about prevention, and then dual qualified in paediatrics, but as well in public health, which is all about stopping people getting sick, stopping bad things happening. And I just think there's with just small changes and a smaller investment, you can actually avoid hospitalisation, which costs people a lot in terms of our dollars in healthcare, but also people don't want to go to hospital. It might be lovely to have a beautiful new Royal Adelaide and expecting a new women's and children's, but most people don't want to come into hospital. So that's really set me on that path of prevention.
Oh, fantastic. One thing that I have picked up, I guess, and most of South Australia has, given your popularity, is that you're very good at communicating as well. Sometimes that doesn't go sort of hand in glove in the kind of profession that you have. Do you think being a paediatrician and working with children and communicating, I guess, what's happening to them and the rest of it. How does that help? And any mentors? I mean, you mentioned your mum, but how you seem to be able to balance the two, and we can understand really clearly what it is that we need to do as a community.
Yes, actually, well, I can reflect back even earlier than that. I used to be really good at maths at school. I used to love it, and I had a friend who wasn't very good at maths, and I was thinking through at the time, even though I was, I might have been in year 9 or 10, I was trying to work out why she couldn't get it, and I realised that she hadn't learnt all of the initial steps, and I really got a lot of pleasure out of breaking it down and explaining it to her, and she got it, and it was so nice to see that light bulb come on. It's a wonderful feeling to be able to explain something that sounds quite complex but put it in simple terms, and then somebody can follow it, and it's a wonderful feeling that you've been able to educate somebody in that way. So then, yes, as a paediatrician, of course, you're not going to get anywhere if you can't speak to children, and again, I have so much confidence in a child's ability to learn. I think we underestimate children's ability, and certainly young people and adolescents, they might get a bit sidelined in conversations because they're not thought to be mature enough. But I have so much admiration and time for the young person as they're a child and then growing up through adolescence. I think they've got so much to contribute to our society and to the dialogue that we're having. Particularly, we need to be thinking about the future. And then as a paediatrician, it's not just the child, but it's the parent. So you have to be able to explain things and have a two-way dialogue. So I think that's all been helpful. So when I'm in front of the cameras doing my press conference, I know I'm not, because the journalists I have got to know very well, spent more time with them than my sounds of know them more than my own family at the moment. Yeah. But when I'm doing the press conference, I'm actually looking down the camera and speaking to the community.
All of us. Yep.
I'm speaking to everybody sitting at home, and I just, because I know if I can explain it and people understand it, they have that light bulb moment. That's why we should be doing what we're doing, and it makes more sense. And you can't fight, I don't even like the term fight, but you can't deal with a pandemic unless everybody's on board.
Of course.
And you're more successful the more people understand and working together on all of those behaviours.
Well, just your message about mask, it's actually our personal choice. And if we want to do that, we can do it if we want to. We don't actually have to. That's great. Can you, before I move off on the leadership, any particularly good books that you've read in relation, any inspirational books that you've read around some of that stuff? And not medical books, by the way.
I'm really bad at remembering the titles of books, so don't ask me a question
no, we're not
like that. But if I can just reflect on the mask a little bit, because it makes me think about one thing in leadership is sometimes you have to stick out to be a leader. So there are so many ingrained social norms because we're social creatures. So if you think about behavioural psychology, so when you wear a mask and you walk into a room and nobody else is wearing it, you feel stupid and you feel like maybe you should be taking it off. And it has happened to me that I've got that feeling and I'm like, no, I'm going to keep it on.
But you're Nicola.
Yeah.
But we're not.
but it's that, it is that sort of sense of uncomfortableness that leaders often will feel, because there's sometimes times when you know what's right because of what your moral compass is telling you and what you know is right for a particular situation that might be different to everybody else in the room. And it's really important that you move through that uncomfortableness. And I'm just giving you the mask as an example.
Well, it's a good one.
But it is a good example of, okay, well, I'm going to do this because this is what I'm going to say this, or I'm going to plan to do this because this is what I know is right.
Can we just talk a bit about you? Because, heck, it's been 2 years. And, look, I have to say, you look better as you go along. So what does stamina look like? I'm really impressed with that. I've had that conversation with you before. How do you maintain, I guess, your resilience and not go, oh, goodness, I'm over this or whatever. You just seem to be really passionate about it. So stamina, what do you do? We need some tips.
Right. Well, I think the first is to realise that there's going to be ups and downs. So there are definitely times when I have had low energy and I'm thinking I can't handle this anymore, the pressure's too great. But if you recognise that these times will occur, then you go and find somebody like Irma to come and talk to, or and I also can I say that Irma, you have been a great source of support
Thank
for
you,
me
Nicola.
personally.
Yeah.
So thank you. But it is important that you nurture those relationships with people that you hold in high regard, and their opinion you hold in high regard, so that you can speak to them during those tough times. So I think it's worth recognising that there will be the ups and downs. I was given a diagram from Denise Picton in the first year of the pandemic. It was about people's and sort of communities' feelings, psychological well-being over the course of a catastrophic event or an emergency. And there's this sense of working together as a community and this heroicism, and you increase your feelings of well-being in that upswing. Then when it's resolved, it goes down, and it's quite difficult because your energies are sapped, you're questioning what happened, and you're feeling quite down. And then there's this slow recovery period. But the problem with the pandemic is it's gone on for so long, and it's had its ups and downs.
Yes.
So it's really important to think of those swings and roundabouts. But the one thing that absolutely keeps me going is running. So I must be totally addicted to my endorphin high. If I can't run, I'll try and cycle to work. It's important I do it in the morning. It clears my brain, makes me feel really focused, better than a cup of tea or coffee. It is cold in the morning, starting to get cold. It's dark. I have my head torch on. So it is, you have to be prepared for that. And what's the name of the wonderful De Castella, Rob De Castella? I heard him speak. Yeah. You might remember the older people listening to this. Wonderful Australian marathon runner, and he trained in Canberra. So I heard him speak once, and he said, don't ask yourself when you're thinking of running, should I go for a run? Ask yourself, when you've done the run, should I have gone for the run? 100% of the time you'll go, yes, I should have done that run. So don't ask yourself the question, just get your shoes on and go.
That's a really good point, because I was doing that about going to the gym. I went back this week because everyone there had COVID. So I went back this week and I didn't ask that question, but afterwards I go, gee, I feel really good.
Absolutely.
And I think that's a really good tip. So can we, and I know you have 3 children of your own, how do you balance all that? I hear that, you have a very good partner that helps you. He does the ironing, I believe. Is that correct?
Yes, he does. He has he's brought a cup of tea to me every morning
goodness.
about 5:15. For our whole married life, which is quite a long time.
So the pandemic had nothing to do with it. That's great.
He was doing that pre-pandemic, but it has been difficult to spend the time with my kids. I've got 2 adult children. You think they're all done and dusted, but they also need the time and the talking time and such like. And then I have a wonderful 14-year-old. He's pretty chilled. He goes about his own business. Seems to be doing well at school despite me not doing very much. But I do have support from my wider family, particularly my mother, in terms of some of those sorts of caring and nurturing. So,
well done. You've got that support network. Let me get back into some of the kind of, and I know you and I have talked about this. You sit around the table on whatever the committees are. So if it's the emergency management group or the COVID ready committee. Look, there's no doubt I've been in leadership roles for a long time. There can be lots of things that go on, but this is particularly intense, I would say. And this comes down to the leadership. How do you manage, I guess, your impact or your influence in those settings, because the sorts of decisions that were being made were probably the most impactful that we've ever had in the whole state. But you're only but one person. You get this public health gig. How have you managed some of that? There have been good times. I suspect there would be some pretty challenging times in those groups.
Well, I think one of the things I learned is that you have to have the art of compromise, right? Because you can't just doggedly stick to something and not see the the rest of the picture. So I think that's one of the skills that I have got, is being able to assess a really complex situation and then weigh up all of these different things that are being juggled and put the puzzle pieces together. So I think it is important to be able to see things from a whole lot of different angles. And also, as I said, be able to compromise if you need to. The other thing is being well prepared, getting as much information as you can. Now, I can't, as a single person, be over all of the various data sources, but I would involve my team, including the CE Chris McGowan, the other, my deputies. I've also very much engaged past chief public health officers, such as Patty Phillips and Chris Bagley, when I had difficult decisions and advice that I needed to put forward. And of course, I also have AHPPC, and this is our national committee of all the chief health officers. We've all been in the same situation. So developing all of those relationships, maintaining them, and getting on the phone and ringing up people, just finding out what their thoughts are, has been really critically important as well. So I think having that background preparation and being able to come in, and I work really well under pressure. So it's often the morning I will be thinking about all the things that are likely to be discussed a few days beforehand. I'll go for a run that morning, my brain's clear, I'll get in early, and I found it very helpful just to make my own typed notes of what I wanted to present, so that I had something in writing that I could go through, make sure I didn't miss anything. So I think that preparation's really important.
Great. One thing that you've highlighted for me as I watched you, and this is really important for public administration, is that we are public servants. And what we've done, and you particularly have done, is that we do serve the government of the day to a particular point. Then you have your own role.
Yes.
And it's that complexity is what you've just described. And I have to say, you have done that marvellously.
Oh, thank you.
And that's what public servants, good public servants, can do. And I think that's something that we can all learn from you in how you've manoeuvred what has been really once in a lifetime. I've not seen this ever in government. I've been around a long time, Nicola. So, look, there's some questions here from the audience, so I'm going to try and rip through them because they're pretty interesting. They've thanked you for leading the state's response. So I've never had so many people say, I can't wait to hear what Nicola has to say. So
we should all go out to dinner together.
That's about 108,000 public servants. But anyway, so they want to know how you manage your own mental health, and I think you've given us a little bit in relation to your cycling or running or whatever. Given all the things that are actually happening on social media, most of it's really positive for you, but there are times and so they've actually said, are you okay?
Oh, that's so nice.
Yeah.
Yes, I'm definitely okay. But one thing I don't have time to deal with social media, and I actually can't be bothered with it. So
you're with me, that's fine.
My kids who are more avid users, they tend to show me the funny things, the nice things, so I don't see the negatives. And also you have to have a bit of a sense of humour. You've got to laugh at yourself, quite frankly. I know I am not very knowledgeable about football. I had zero interest in footy before the pandemic, but because I have needed to be more involved, I have actually developed a slight interest, not a large interest, but I did sit and watch the showdown on the weekend.
Nice.
Which was terribly disappointing because I've decided that I'm now barracking for Port, and I don't really know what happened in that game.
I know we're really good friends.
But it was a shocker, so...
Yeah. Okay, well, good. You've got a bit of heckling around the football with that, yes. So another question is, how do you assure parents regarding the safety of the COVID vaccine in children? So someone's raised the 5 to 11 years, long-term implications, but you may,
Well, look, so children are the most vaccinated people in our community, really, because as soon as the baby's born, they get a hepatitis B vaccine. So
yes, of course, yeah.
So as a paediatrician, we're used to explaining the importance of vaccination. and any potential side effects. So it's no different really with COVID. So I'm just so pleased that we're able now to offer the children vaccines, and I'm really hoping we get a continuing uptake in that age group.
Good. So a lot of people here, Nicola, you've been through a lot of pressure, focus on you during the pandemic. I think you've probably covered this, but I want to be true to the questions. How can we learn from your courage, resilience, self-care that you've demonstrated? What's a tip for all of us?
Well, let me see if it's a single tip. I mean, I think it's good to have other interests as well, with perhaps something I haven't talked about. So I do other things at home that I can pick up quickly, and I've always had this philosophy, just because you don't have 3 days to do something all in one go doesn't mean that you shouldn't do it a little bit every day. So I do some dressmaking, so I've got
I heard you sew some of the clothes that you wear. Oh my God, skill as well.
But it's just a way of switching your brain off and focusing on something that's more creative. Also, I'm a very keen gardener. I can't do the whole garden all at once, so I just try and focus on a little bit that's manageable. Other people have different hobbies. I was relearning the oboe before the pandemic. It's quite a difficult instrument, and unfortunately that is something I haven't picked up again, but I am trying to work out how I can fit that in this year.
Okay, well, hopefully you'll get a break. You're going on holiday. So a lot of thank yous here again. So one question here is how do you separate emotion from mental decisions? So someone here has asked, they're interested to hear how you overcome your own biases, so your own take on something in decision making.
Yeah, that's a really interesting question. And I have done training in unconscious bias, particularly when I did my leadership course, but also thinking around Aboriginal health and those sorts of issues. And I think having that group of experts, I have got them in a room and said at some points, please, can you be my crap detectors? What is it about my thoughts here and my advice would you critique? So I think having multiple sets of eyes on that is important. I'm not sure about how you separate the emotional from the mental, because actually the emotion is important. So I am really passionate about the health of South Australians, and it might sound a bit corny, but I don't want people to get sick. And so that drives me, and I keep using that as my sort of moral compass. So I'm not sure if I've answered that question accurately. But
I remember you saying to me, my job is to keep everyone safe.
Yeah.
And I think the complexity is others come to the table to get the data or to run the state. So everyone's bringing that's how you balance it. But I love the fact that you're very clear that your job is to advise on how we can be as safe as we possibly can be, which I think is great. So this is a tough one. There's thank yous everywhere for your tireless work. So a general thank you.
Nice.
How do you decide what is, and this is a tough one, you may not be able to answer it, what is an acceptable level of death in the pandemic? But I think we need to be careful about just talking about pandemic, because flu season does the same for the state. So is it the same as flu season deaths, or so how do you deal with that?
Okay, so look, this is a really tricky one, because personally I would rather prevent any deaths from COVID.
Sure.
But there are people in our community that are either right at the very end of their life, and it wouldn't matter whether it was COVID or a urinary tract infection, but it's just that little thing that tips you over the edge. But one of the things I have reflected on since we've had Omicron is we haven't had much discussion about the number of people who have lost their lives, and it's perhaps something missing, really. And when I do press conferences, if we are reporting people have lost their life, then I do want to acknowledge that, because it means that there's somebody special in somebody's family who's passed away, and that it's a tragedy for that family, regardless of the age of the person.
But there's a whole lot of other things, whether it's mobility or the flu or whatever. So, we don't report on those things. So I think it's become quite overwhelming, and for people to kind of comprehend, I guess, all of this talk.
Yes.
We shouldn't hide it, but it's actually how do we talk about death and dying and circumstances sort of around that.
Well, death is a bit of a taboo subject in our society, and it's not something that particularly frightens me, I guess, because I'm used to dealing with people that have died. So a body, in as much as it's not something that I would personally get so scared about, but it does tend to be a taboo topic.
And it does affect, and of course, as you said, people are very close. The last few questions. When COVID was first diagnosed, did you think we'd go this long, and or was it one of those unknowns? Because super spreader. Did you think it was that? So what did you think in the beginning?
So I didn't think it would go this long.
Oh.
I really didn't think it would go this long. I got out my copy of Albert Camus. My daughter Phoebe suggested I read this. I cannot read in French, so I read it in English. It was a novel that was written about the 1920s, 30s, and it was based in a little town in Algeria, I think, and it was the plague occurred. And so the pestilence, the plague, and it wasn't recognised by the people in the town because they were too busy catching planes and going about their business and making money or doing what they do as townspeople. And there was a doctor, Dr. Ryu, who had. The quote was something like, had just a little bit more imagination about the suffering of people, and he realised that something was serious and it was the plague, and they locked the whole town down, and there was even an exemption committee with names of people that sounded like our exemption committee. So it was the whole process took quite a long period of time as the novel unfolded. So but I guess because we'd never had a pandemic of this nature, it was very hard to predict, but I think we all thought it was probably going to be shorter. I think the real positive was when we got the vaccinations, and we thought, here is something that's going to end it. But then we got Delta, we got Alpha and then Delta, and then, by the time Omicron came around, because we'd experienced Delta, I suppose we were a little bit more wary that there could be another variant, and we're like that now. So we can't predict what the future's going to hold. There could be easily another variant. We don't know how that would work with the vaccines, but the fact that we've got 3 safe and effective vaccines has just really taken the wind out of this pandemic sail.
Oh, good.
And has allowed us to get back to a much more normal. It doesn't mean that we wouldn't want to keep our surveillance up and our systems in place should we be faced with something else. But look, I think we're getting there, but it is very difficult to predict what's going to happen next.
Oh, well, I suppose we can't.
No.
So finally, another huge thanks to you and Grant. And look, I just need to say to you and Grant, I think you've been sort of a shining light for the public sector.
Oh, thank
and
you.
We've been able to kind of restore, I think, a high level of confidence in what public policy and public response looks like. So thank you for being sort of the lead in that. And thank you for maintaining superior calmness, it says here, and strength in very difficult, complex situations. So my final question to you is, what's beyond the horizon for us in relation to the pandemic, for you in your role? And so what's the new normal going to look like in your eyes?
Well, look, I will be very happy if people keep following some of the pandemic behaviours. I don't want people going to work sick with runny nose and cough and such like. We shouldn't have that presentism at work. We should be happy to have people who can effectively work from home. That means they're more available for their family. They're not spending time in a car, increasing our carbon emissions. If people are able to work from home, then I think we should be supporting that. From a healthcare perspective, we have changed so many things. One of the when we're looking at the number of hospitalisations, in addition to that, we're supporting people outside of hospital in their home through virtual care, through telephone and video. Not to say that we don't need hands-on. You obviously, got to be in front of a surgeon if you've got appendicitis. But there's many things that we could be doing in healthcare where people can remain at home. Other things such as when we first started, we didn't manufacture masks very much at all. I think there might have been one little place in Australia. So thinking about onshore manufacture and making sure that all of those supply chains for our important pharmaceuticals are all in place. Those things I think are really important. But getting then past the pandemic, what else is a threat to human health? And it is climate change. And that is through a huge range of things. We know when we have heat waves, we have more patients presenting to hospital with kidney problems, high blood pressure, strokes, cardiac. So that's heat. Then we'll have more bushfires, floods and the like. And then in terms of communicable diseases, the expectation we will have more emerging infections, communicable diseases, as this really very delicate balance between the environment, humans and animal health is challenged. So there's a lot I think we need to be doing right across the public sector. I feel responsible in health because it is one of these things that we should be looking at preventing, and in terms of mitigation and adaptation. So that's a really big thing to talk about, but it is real and it's here now.
Well, on that note, I think we're very, very fortunate in South Australia to have you, Professor Nicola Spurrier, leading us during this pandemic, and you've been an absolute inspiration, not only for this interview, but for what you've done for all of us. So given the number of thank yous, I really think that we have been very fortunate here in South Australia to have you doing this for us. So thank you very much. I found it in particular insightfulness and very enlightened in terms of what we should be doing next. So, thank you everyone for listening to us today. I'd like you to visit IPA SA's website for more events, including our next session on our new Mental Health and Wellbeing Check-In webinar series for the public sector, taking place virtually on the 21st of April. We'd like your evaluation form filled out, seeking some feedback from today's forum. More thank yous, I have no doubt, and that's on the IPA website. Please take your time to have a look at the upcoming events. And once again, thank you so much for tuning in. It's been wonderful. Thank you.
Thank you very much, Emma.